Good day and welcome to our annual Patients First Luncheon for the Jordan Health Foundation. I'm Don Alhart. You know, we have been attending these gatherings for as long as I can remember, and of course, at my age, my memory isn't what it used to be. But if memory serves me correctly, I first shared bread with you at the old Holiday Inn on the river before we moved on to the Floriano Riverside Convention Center. We do have a challenge this year in more ways than one. First, fellowship, the interaction at our luncheon tables. The electricity in the ballroom is missing. We are not together physically, but we are together in spirit. And the spiritual ties that bind us together are strong. And they're the strength that help us meet the other challenges in these trying times. The challenge of poverty. Did you know that 52% of Rochester's children in zip code 14621 are living in poverty? 19% of adults in our city are living with diabetes. Jordan Health has provided 26,000 patients, and 73% of them live in Rochester's most impoverished neighborhoods. And that really is the challenge of our foundation, the purpose for gathering today, the growing support to empower Jordan Health to meet these health needs. The funds that are raised through this luncheon are one way, and of course other special events throughout the year help as well. Your donations can help, and you can also help by sharing your knowledge with others. Engage in conversation about the needs you will hear about today. Let others know that they can help as well. Often our words are as valuable as our dollars in our wallets. Don't waste either of them. We are grateful to the major donors, the sponsors of our luncheon today, and they include Rochester Regional Health, URMC Strong Memorial Hospital, URMC Highland Hospital, United Healthcare, Fidelis Care, Alesco Advisors, Bond Benefits Consulting, ESL Federal Credit Union, Excelis Blue Cross Blue Shield, Lydia Marshall, Van Hook Service, and the Bonadillo Group. Now it's my pleasure to introduce a good friend and President and CEO of Jordan Health, Dr. Janice Harbin. Dr. Harbin has been a clinical dentist since 1979. She served as dental director for the Detroit Healthcare for the Homeless from 2003 to 2009 and moved to Rochester in 2012 to become Jordan Health's Director of Dental Services and became CEO in 2013. Dr. Harbin.
Thank you for joining us for Jordan Health's virtual Patient First Luncheon. I know many of you are disappointed we could not serve you the Riverside Convention Center famous chicken lunch. However, we hope that you have managed to find an adequate substitute. Jordan Health is pleased that in these trying times, we have found a way to come together. It is coming together as community that we find the strength to meet these enormous challenges that lie ahead. 2020 has been a year beyond anything we could have imagined. As the COVID pandemic drags on, countless families are faced with eviction, homelessness, and hunger. Trusted institutions such as the Post Office and CDC are under attack. Our kitchen tables have become schoolrooms for children or offices for their parents. Before 2020 is over, we will have gone through a bitter and divisive election. Even the simple act of voting has become confusing, yet we know no election in our lifetime will be more important. Over the last 6 months, our healthcare systems have been stretched to its breaking point. Jordan Health has not been immune. We have faced challenges we have never could have imagined. In March, within a matter of days, routines and protocols of healthcare delivery has been changed to ensure that our patients and our employees remain safe. Our revenue-generated services have plummeted as medical and dental visits were cut back sharply in an effort to remain compliant by social distancing and addressing only the most urgent medical and dental needs. At Jordan Health, we have learned a lot of new skills. We learned transitioning to delivering virtual health care via computers, smartphones, and landlines does not take the months that was outlined in our original plans. No choice is a strong motivator and a great teacher. Surprisingly, both our clinicians and our patients have embraced telehealth. We learned how to work as a team while working from home. And we learned how to turn on a dime when the health departments come out with new guidelines right after you have implemented the ones that came out the day before. We took advantage of every resource available and retained all of our staff. No layoffs, no furloughs. We continue to maintain sufficient personal protective equipment for all employees to keep them safe. In the 6 months of this pandemic, we have not had a single case of COVID transmission at Jordan Health. Not patient to staff, not staff to staff, or staff to patient, none. We have answered the community call for more testing, launching our respiratory center at our Jordan Center and outreaching into minority neighborhoods with Saturday community testing at our Woodward and Brown Square centers. As a neighborhood safety net in Rochester since 1904, we are fortunate to report we are still Jordan strong. With all the despair which has happened this year, 2020 has brought some unexpected gifts. It has called attention to the flaws of our society. It has dragged into the sunlight those things we have tried to bury or overlook over the years. 2020 is forcing us to acknowledge that this country is great and abundant for some, but not for all. It has removed the blinders, which has made it convenient for us as Americans to turn a blind eye to what we knew to be true. Systemic racism, income and health inequality has been who America is, but it's not who we could be. This pandemic has highlighted the neglect and underfunding of our public health infrastructure. As the COVID death count went up, finally, health officials began to recognize that people of color were dying of COVID at a disproportionate rate than whites. What was alarming was they were surprised, as if they didn't know marked racial disparities impacts whether you live or die. Just ask the residents living in zip codes of Rochester's Crescent the number of years of life lost just because they're black or brown and poor. At Jordan Health, we have been fighting diseases brought on by toxic stress of racism, limited opportunity, and poverty for decades. The COVID pandemic has pulled back the curtains on health disparities. Now the nation sees what Jordan and other federally qualified health centers have already seen. Even as COVID continues to race across this country and turn lives upside down, the shocking videos of black men and women dying at the hands of the police put racial injustice squarely in the public eye in a way that cannot be brushed away. Young and old, black and white citizens have taken to the streets to demand change. Increasingly, white people are understanding the concept of privilege, which up until now has just been a way of life. They are joining people from all walks of life to declare Black Lives Matter and to affirm that we are one nation under God. As a healthcare provider, we truly recognize systemic racism is a public health issue. That is why Jordan Health is proud to join organizations across Rochester and Monroe County by endorsing the Greater Rochester Black Agendas Declaration, Racism is a public health crisis. At Jordan Health, we are committed to making our communities places where injustice will not be tolerated, not by civil servants, not by policies, not by elected officials. We not only have a voice, we have an obligation. John Lewis said, when you see something, you must do something. At last, we have the attention of our community and the attention of this nation. It is up to all of us to make 2020 the beginning of what our city, what our county, what our nation could be, and not what it is. Thank all of you for supporting Jordan Health and supporting the mission of serving the underserved.
My thanks to Dr. Harvin. Now I'd like to introduce our panel discussion and our panel members. Lynn Mall is a registered dietitian and diabetes educator with Jordan Health. She believes peer education and support is a powerful motivator in helping folks with proper nutrition and exercise. Michelle Hannigan, Director of Clinical Operations and Systems Integration, has served Jordan Health patients for nearly 20 years. Maya Reagan is a receptionist at Brown Square Health Center, working to become an LPA and a physician's assistant. Charles Nash is a security guard at Brown Square Health Center. Charles considers himself a part of the fabric of Jordan Health. Jordan's patients describe him as big-hearted and supportive. Barry Johnson and Tina Noble are both patients of Jordan Health, and both will share the impact Jordan has had on their lives and the lives of their families. Welcome to you all.
Good afternoon. On behalf of our more than 27,000 patients and the incredible people who make up our frontline staff at Jordan Health, I too want to welcome you to our Jordan Health Foundation's virtual Patients First Luncheon. I'm Michelle Hannigan, Director of Clinical Operations and Systems Integration at Jordan Health. I'll be co-hosting our roundtable discussion today, along with my colleague Lynn Mall, registered dietitian, certified diabetes educator with us at Jordan. As a member of the Jordan Health team for nearly 10 years, and having worked almost all of my 20 years in healthcare in community health, I have experienced firsthand the positive impact that Jordan Health has on closing gaps in healthcare inequities. We've not done this work alone. We have some pretty incredible community partners, and you're going to hear more about them in just a few moments. As COVID-19 continues to shine a light on the ethnic and racial health disparities we are struggling with in our world today, it is vitally important that we share the stories of our patients at Jordan and our frontline workers at Jordan. They're the ones facing the challenges brought about by this pandemic. Today's roundtable discussion is a very personal story of community health. In just a moment, you'll hear our patients and our staff share their stories of how Jordan Health partners with them each and every day to reduce the negative impact of healthcare disparities in their lives.
Welcome. Thank you very much for coming today. I'm going to introduce you first. Okay. This is Charles. Charles works at our Brown Square Center in security, and he's been involved in a lot of different aspects sees a lot of things coming and going over at Jordan Health, right?
Oh, yeah.
Here's Maya. Maya's also from Brown Square, our Brown Square Center, and Maya is one of our receptionist extraordinaire over at Brown Square Center. So thank you for coming.
Thank you.
And this is Barry. Barry is one of our patients, also hailing from the Brown Square Center. So we appreciate you being here, Barry, and sharing all your. Thanks. Thank you. So you have all been with the Brown Square Center. Tell me, what is it that makes that place so special?
Honestly, just the atmosphere. Mm-hmm. It's like, for some reason, it's like a homey kind of feel to it.
Yeah.
It's like everybody knows each other. It's like just one big family, basically.
Yeah, you know both Maya and you know Charles, too. Mm-hmm. Don't you and Charles have a history together, right?
Yeah, we do. Oh, yeah. Yeah, Barry's, that's my brother right there. I mean, we go all the way back to Charlotte days.
That's great. And then you met Maya at Brown Square, right?
She always told me to make sure that I come. She always made sure that I came,
Yeah.
like hands down.
Yeah.
If I forget the appointment was coming up, she was always one that made sure that she called me, told me to make sure I come. If I don't come, she's gonna come to my house and beat me up. But she always made sure that I come.
She held you accountable, didn't she?
Oh,
Yeah.
yes.
Yeah. And Maya, you talked to a lot of the patients.
Yeah, I made sure I called everybody and make sure that they come. It's important for me that they come just to be able to see them and see them progress and their goals in terms of their health. And so, yeah, you're not the only one that I would bully to come. But it was very important. It was very important to me to see everybody there because
Yeah.
I know how important it is to them and to our team. So
Right.
I always call.
The Healthy Weight and Wellness program was something that a lot of our patients all over Jordan really enjoyed, and we were so happy to bring it over to Brown Square. What did you get out of it, Barry?
Honestly, I got a lot of different exercises I could do, like down different websites and different things to look up on YouTube that I could do for the exercises. A lot of new recipes.
Yeah.
Honestly, met a lot of great people.
Yeah. Yeah.
So it was a very good experience.
Yeah. And Charles, you were involved in them also, right?
Yeah, I was kind of, I'm not going to say I was, because it was like one night I was picking up a shift and they said we had a wellness group tonight. And I was like, what is that? So I just sat there and I heard people talking and the different ways of changing your the things that you eat, making it more healthy. And I was like, yeah, I got to be part of this, because I mean, being a big guy as myself, if there was different ways I can eat the things that I like but make it healthy, why not? Yeah. So I was like, I gotta, and I kept on calling, when is it gonna happen again? When is it gonna happen again? I tell you, and then when is it gonna happen? And when it happened again, I made sure I was there. I was doing my job, but I made sure I was there, learning different exercises that I can take and make them my own.
Yeah. So what kind of challenges do you face at home with keeping healthy, being healthy?
If I had to guess, I'd say just the motivation, 100%.
Yeah.
Because we're at home, it's like that's the time you just relax and you just get lazy and just not want to do anything. So just that motivation to get up and do stuff.
So, and Maya, you've talked to a lot of people.
Yeah.
So what do you hear from them? What kind of challenges do they have?
So I think the hardest thing about it was, like Barry said, is the motivation to do it outside of the group. They have to be on themselves when they're not in the group. So
Right.
I think that was the hardest part for them. Another thing is basically, being able to get those healthy foods to make all of those healthy meals, because, we deal with a community that it's not easy access for them to be able to have those resources. So that was a challenge for them, but they found a way, and we would give them resources like Food Link, or Colleen would tell them where she got her food from, and they would be like, I didn't even know you could get it from that store. So I think it helped that they had Colleen or Terry, yourself, to give them those resources to learn how to be able to do that outside of the group, not just one night every couple of weeks.
So what about, you both were talking about exercise. How easy or hard is that in Rochester?
Because of COVID now, it's kind of hard. I mean, I used to go to the Planet Fitness, and now that that's closed, you got to start doing more home exercises and finding out different places and not trying to be around a lot of people to stay safe, but also do your own exercises, walking a lot, depending on where you live at. So it kind of determines depends on where you live at and what your workout regimen is.
That's the main thing, the safety part.
Safety, yeah.
Especially everything going on in Rochester nowadays, it's just like you really don't know where to go 100%, because the gyms are closed and you don't want to walk around the neighborhood and just risk getting hurt.
What about you, Maya? How do you get exercise in?
Around me. I run around my 3-year-old all day, But Usually at-home workouts are kind of what's best for me just because of the schedule that I have. So going to the gym isn't really going to fit in my schedule. So
Right.
like he was saying, Colleen is really good about giving us those workouts that we can do sitting down in the chairs in
Yeah.
our small living room if we have a small living room or stuff like that. So for me, that's what I like to do is the home workouts. I used to go to LA Fitness. I know the YMCA, they have a good program that basically works with people in terms of their finances and where they are financially, so you can pay what you can. So that has helped me before as well. So
Yeah, and you can speak to that to some of our patients too, because that's the
Yeah.
way that they, you know, everyone has a different way that they want to exercise and what works for them.
yeah.
So what really has helped you out about Jordan Health Center? What has helped you with your health?
Before I came to Jordan, it's like my doctor, only thing that she came up with any excuse. Like I went there, for example, said I had a headache. First thing she said was, well, it could be because of your weight. And it's like everything circled back around to that for some reason. Jordan Health, they actually like, okay, well, what's going on? What kind of side effects are you going through right now? Like they'll prescribe medicine if needed. So yeah, they actually help you out with everything.
Yeah, so it sounds as though they really tried to dig in and find out what really is going on here, right? Yeah.
I know before Jordan Health, I didn't really have a doctor, and that's when I ended up getting insurance, and they ended up setting me up with the doctor. I got to meet with him, so it's like my doctor's office is where I work at, so it's like they stay on me, drink more water, drink more of this, do more of this, but they're not doing it just because it's a job. They're doing it because they care. They want to see. They want you to be around. They want you to stay healthy, and they find different ways of working around. Well, you don't got to cut everything out because they know how hard it is. They know that you're human. They know that you make mistakes because we all make mistakes. We all will slip up and eat something we ain't supposed to, and they understand that. They're not gonna go down your throat about that, but they just want you to be healthy, and they know that people do make mistakes.
Thank you very much for taking the time to do this today. I
problem.
appreciate it. Thank you.
No problem.
Hi, Tina. Thank you so much for being here with me today.
Thank you, Lynn. Thanks for having me.
Well, so we go back a long time.
Right.
So how far back do we go? You know?
I at least want to say it got to be a bit over 10 years from when I first found out I had diabetes. So yeah.
Yeah.
It's been a while.
Yeah. And you were pretty upset
Yeah.
when I first met you.
Yeah, I think I was pretty upset when everybody, because I didn't know what was wrong with me.
Yeah. But you came around.
Yeah.
So tell me about your health story here. You know, what triggered you to, really take care of yourself, of your health?
Well, it was like 2008 when I was diagnosed with diabetes, and I really didn't know what it was. I just knew it was bad. And I think that's when I got to see you, and then you put me on about, what was diabetes, what was good, what was bad. And then after that came high blood pressure, and it's a long history.
Yeah, but you've done such a great job of pulling
Yeah.
it all together and making it work.
Diabetes scared me. 'Cause like I said, I didn't know what it was, and I knew it was a killer, so it scared me.
Yeah.
So I knew I had to do something. And you helped me.
Oh, thanks.
Yes.
Yeah. There were other people and other things that have helped you too.
Yeah, well,
Like you were involved with the Healthy Weight and Wellness program, right?
Yes.
Number of times you went through that.
yes, and I love it.
Yes.
I'm waiting for us to have it again.
I know.
So, okay.
So what is it that you get out of that? What is the best thing that you get out of that?
Well, for me, is the tools that I know that I can take with me to know how to eat healthy, how to be healthy, and how to stay healthy.
Yeah.
And that meant a lot to me because, the stuff that you taught us, I never knew that. And that plays a big part, and it frightened me to know that I was putting all that in my body with diabetes, high blood pressure, and everything, and cholesterol with the oil, the sugars, and the salt. That's overwhelming.
Yeah, you were involved with our Cooking Matters program.
Yes, I love that class too.
Yeah, tell me what you learned at it. What was
Again,
the most impactful thing?
the sugars, the salt, and the oil.
Okay.
I mean, it really amazed me how much sugar was in a 12-ounce can of soda.
Right.
How much oil that you get from the places that you eat at.
Yeah, like the fast food places.
Holy crap. That's really overwhelming to me.
Yeah.
So yeah, that right there, that put a way heavy toll on me. Like, this got to change.
So what's the hardest thing for you about translating some of the stuff that you've learned with what's going on in your community? I mean, I know at one point in time you were like right down the road from a McDonald's and a Salvatore's.
I'm still there.
You still are?
I'm still around the Chinese restaurants. I'm down from Burger King, but I cook.
You cook at home.
I cook. That's the big difference. I mean, I enjoy eating out, but I mean, it's different. The food tastes better when you cook it yourself.
Yeah.
You know what you're putting in your body.
Right.
You know how much salt you put in your body, how much sugar you put in your body, how much oil you put in your body. That's the biggest thing for me, so you already know that.
Yeah.
So that's what's changed for me.
Tell me about some other people at Jordan Health Center that have helped you out too, or programs, or how.
Well, I really, only program I've been in is the one that you put me on, so I haven't really done anything else. And as far as the people at Jordan, I have my care manager, which is Christina. My behavior she's gone now, which was Gail, and I miss her.
So what about, is it hard, easy for you to find some fresh fruits and vegetables?
Nope.
Because that's what we promote.
Nope, not at
Okay.
all. I can easily go in the store, and then Christina put me on the food link thing,
So
the
yeah.
registry, and so yeah, and they give you mad fruits and vegetables.
So that's the Food Links food distribution program
Yes.
that we've been.
Yeah.
Yeah.
And I liked
okay.
it. Then also when we was doing the coupons for the truck,
That was the
I
veggie.
missed that.
Yeah. So that was a veggie prescription program that we
I
did.
missed that.
That was
really
good.
that was really good for the community.
What did you like about that so much?
It was cheap.
Yeah.
$1 goes a long way on them trucks.
Yeah.
So I mean, that's what I really miss about it, and I wish we can start it back up though.
I hope that we can too. We'll work with
I mean,
Food Link
because
on
like I can find, like you give me a list, and I found places like when I was over there on Parcells on Culver, I can go to Parcells and get my stuff, and it was really helpful. I put my daughter on, my son, and you go there and shop and get our fruits and vegetables
that. Off of the curbside truck.
off the curbside truck.
Yeah.
Even when I was at Jordan, if I had an appointment and they announced it over the speaker, I'd go outside and get it then.
Because the curbside truck came to Jordan.
Exactly.
Yeah. You were there at the some of our groups when we had our clinical pharmacy team there. Do you remember them?
I remember because I know I had questions about some of the medications I was taking. So, I mean, they were helpful too, because I was trying to figure out, they give me medicine, they say you can't take these two together, but then I'm told you can. I don't know, it was crazy.
So they can help sort those things
Yes,
out, right?
Yeah.
But it's got to be a little bit comforting to know that there's somebody who you can go and talk to about
Right,
it.
right. So, I mean, like, I done got familiar with the pharmacists at Jordan. The people at Jordan, I can actually talk to them if I have problems too, and they easy to talk to because, like, if I got a problem with my prescription, they'll get on the phone or I can talk to them. They're very helpful.
Yeah.
Yeah, so I mean, Jordan is cool. They got their good perks.
Yeah.
I mean, I recommend them.
Yeah.
Yeah.
That's wonderful. What about, you remember Willie Murphy?
Yes.
Yeah. Now, isn't
Yes.
she the top motivator?
Yes. The little muscle lady.
Yeah. She came in and helped out with some exercise and motivation,
Yeah.
right?
Yeah. I mean, then we got her CD. So yeah, I remember her, and then the lady that came and did the Tai Chi. That's why I put it up on YouTube. So I do the Tai Chi in the morning.
Wonderful. So
Yeah.
that was with Lifetime.
Yeah.
Yep. And that was Sarah Otis who came in and did Tai Chi with everyone.
So I wish that's one of the things I wish that they would do at Jordan. Bring that into like once a month. You know, people to join up, like the healthy wellness people
Yeah.
or anybody, just so they can know the feel of doing Tai Chi. They
'Cause-
just don't know how relaxed they will be.
Right.
Even doing the thing of meditation, I pull everything out for YouTube.
Yeah.
So
That's great.
You gave me that tool, so she gave me, said use this app. I pulled it up on YouTube.
Good. I'm glad you use those. That's great. It's always great working with you.
You too, Lynn. You know, I'll be glad when we get back together.
I know. Thanks for coming out and seeing me today,
you are
Tina.
so welcome. Thanks for having me.
Appreciate it.
Okay.
Lynn, we've heard you talk about some amazing community partnerships. We also heard how critical those partnerships are to our patients and our staff. Tell us a little bit more about some of those key partners.
Yes, Michelle, our patients and staff would not experience the life-changing success we just heard about without our community partners. We have so many. Can I tell you about a few of them?
Yeah, that'd be great. Let's hear.
All right, so FoodLink, they're a giant in the Rochester community, right? Yeah, they model true community partnering, taking on the systemic barriers inherent in our food systems. Things like lack of access to healthy foods, lack of access to fresh foods, lack of good nutrition and education. FoodLink partnered with Jordan to bring a unique vegetable prescription program to our patients via the curbside market. They've done a lot of cooking demonstrations in our lobbies, and they also worked with us to bring the Cooking Matters program to our patients through the Healthy Weight and Wellness program, and that allowed our patients to learn how to prepare and to cook some of those healthy fruits and vegetables that they find on the curbside market truck. When we talk about the impact of lifestyle changes in nutrition and diet, FoodLink has been a fighting force with us, shoulder to shoulder, to eliminate healthcare disparities in our community.
That is so powerful. It just reminds me of how important these partnerships are, and you can hear it in the stories that we've heard from our patients today, right?
Yeah, absolutely.
Anybody else you want to highlight before we close?
Yeah, they is it St. John Fisher College. Their clinical pharmacy program is another one of our partners. Dr. Sean Fellows and Dr. Gabriella Cipriano bring their fifth-year pharmacy students to intern at Jordan Health Center. They work directly one-on-one with our patients or within our groups. They provide another opportunity for our patients to understand what their medications are, why they're being prescribed, how they should take them, and also to learn about some lifestyle changes that they may be able to make to help improve their health conditions and perhaps go off some of these medications. It's all about the education, and the pharmacy team is another one of our community partners to help bring that to our patients.
That is exciting. And so that reminds me to say, you know, you want to learn more about what our community partners are doing to reduce healthcare disparities in our community, please head to the Jordan Health Foundation website. It's on the bottom of your screen below. Follow that URL. This is some amazing work that we're doing with our partners.
Thank you to our roundtable panel, which brings us to our closing remarks today. A gathering for Jordan Health, a gathering oh so fine. Instead of sharing tables, this year it was online. COVID is to blame, of course, which is why we say support for those at Jordan Health is even more in need today. So remember what we shared today, remember what you heard, and tell the Jordan story and help us spread the word. Remember, we put patients first. For that, we give a cheer. And pray we gather face to face when we meet again next year. Have a great day.
Thank you, Lynn, for all you do every day to make a difference in the lives of our patients and in our community. And our deep thanks to Tina, Charles, Barry, and Maya for sharing their personal stories with us today. These are unforgettable stories. These are the very real people we call Jordan family. And to you, our viewers, our listeners, our supporters at home, we ask you to continue joining with us, your hearts and your hands, as we together work to turn the tide of systemic racism in healthcare. We are all community health. Thank you, and be well.